As we age, our bodies undergo numerous physiological changes, and one of the most critical health concerns for seniors is blood pressure management. High blood pressure, or hypertension, is a condition that affects more than half of individuals over the age of 65. While many assume that strict medication regimens are the only solution, modern medical research emphasizes a more balanced, personalized approach that prioritizes overall well-being rather than just achieving ideal numbers on a monitor. Controlling stress, making lifestyle adjustments, and tailoring treatment plans to individual needs can often be just as effective as medication in maintaining healthy blood pressure levels. One of the most overlooked factors in managing blood pressure is the role of stress. Emotional strain, anxiety, and poor sleep quality can all contribute to hypertension, yet they are rarely addressed in conventional treatment plans. A senior who experiences daily stress, perhaps due to financial worries, loneliness, or chronic pain, may see consistent spikes in blood pressure despite taking medication. By incorporating stress reduction techniques such as meditation, deep breathing exercises, and engaging in fulfilling social activities, many older adults can experience a significant drop in their blood pressure levels naturally. A personalized approach to treatment, which includes open communication with healthcare providers, allows patients to discuss concerns about side effects and set realistic health goals that align with their lifestyle and preferences. The aging process itself has a profound impact on blood pressure regulation. Over time, arteries lose their elasticity, becoming stiffer and less capable of adjusting to fluctuations in blood flow. This increased vascular resistance forces the heart to work harder, leading to a gradual rise in systolic blood pressure. Additionally, hormonal changes occur as levels of renin and aldosterone decline, making it more challenging for the body to maintain an optimal fluid and sodium balance. The kidneys, which play a vital role in filtering excess fluids and maintaining blood pressure stability, also become less efficient with age. As a result, many seniors experience gradual increases in blood pressure, even if they follow a healthy lifestyle. However, this is not always a sign of illness, rather, it can be a natural adaptation of the body. When it comes to treatment strategies, there is often debate over whether standard or intensive treatment is the best approach. Traditional guidelines recommend maintaining blood pressure at a level of 140 to 150 mmHg for elderly individuals, particularly those with multiple health conditions. This approach seeks to balance the benefits of reducing blood pressure with the risks associated with excessive medication use, which can sometimes lead to dizziness, fatigue, and an increased risk of falls. On the other hand, intensive treatment aims for a stricter target of 120 to 130 mmHg, which has been shown to reduce the risk of stroke and heart attacks. However, it also comes with the potential downside of side effects such as hypotension and kidney complications. Ultimately, the key to effective blood pressure management lies in regular monitoring, maintaining an active and balanced lifestyle, and carefully adjusting treatment based on individual health conditions. Seniors who incorporate moderate exercise, a nutrient-rich diet, and mindful stress reduction techniques into their daily routine often find that their blood pressure remains stable without excessive reliance on medication. By working closely with healthcare providers and focusing on overall well-being rather than rigid numbers, elderly individuals can enjoy a longer, healthier, and more fulfilling life. Managing blood pressure in elderly individuals requires a comprehensive approach that extends beyond the conventional reliance on pharmaceutical interventions. A combination of stress control and personalized treatment strategies has proven to be highly effective in addressing hypertension while simultaneously promoting overall well-being. Stress, a significant yet often overlooked contributor to elevated blood pressure, triggers physiological responses that can exacerbate cardiovascular strain. Personalized treatment, on the other hand, ensures that medical interventions align with an individual's unique health profile, lifestyle, and specific risk factors, thereby optimizing therapeutic outcomes and minimizing adverse effects. The physiological response to stress is primarily governed by the autonomic nervous system, which is responsible for the body's fight or flight reaction. When an individual experiences stress, the adrenal glands release catecholamines such as epinephrine and norepinephrine, which induce vasoconstriction, increase heart rate, and elevate blood pressure. While these responses are beneficial in acute situations, chronic stress leads to sustained elevation in blood pressure, placing undue strain on the cardiovascular system. Prolonged activation of the hypothalamic pituitary adrenal (HPA) axis results in excessive cortisol production, which contributes to insulin resistance, weight gain, and endothelial dysfunction, factors that collectively worsen hypertension. One of the most effective non-pharmacological strategies for mitigating stress-induced hypertension is the implementation of relaxation techniques such as mindfulness meditation, progressive muscle relaxation, and controlled breathing exercises. Mindfulness meditation, for instance, has been extensively studied for its ability to reduce sympathetic nervous system activity while enhancing parasympathetic tone. This shift in autonomic balance leads to vasodilation, reduced heart rate, and consequently lower blood pressure. Progressive muscle relaxation, which involves systematically tensing and relaxing different muscle groups, has been shown to lower cortisol levels and enhance overall relaxation, making it a valuable tool for stress management in hypertensive patients. Beyond relaxation techniques, engaging in regular physical activity is another crucial element of stress reduction and blood pressure management. Aerobic exercise, such as walking, swimming, and cycling, has been demonstrated to improve endothelial function, increase nitric oxide bioavailability, and reduce arterial stiffness, all of which contribute to better blood pressure regulation. Furthermore, exercise-induced endorphin release plays a crucial role in alleviating stress and improving mood, thereby counteracting the detrimental effects of chronic psychological strain. The interplay between sleep quality and hypertension cannot be overlooked. Sleep disturbances, including insomnia and obstructive sleep apnea, are well-established contributors to elevated blood pressure. Poor sleep hygiene disrupts the body's circadian rhythm, leading to heightened nocturnal sympathetic activity and impaired blood pressure regulation. Patients with sleep apnea, in particular, experience intermittent hypoxia, which triggers oxidative stress and systemic inflammation, further exacerbating hypertension. Addressing sleep disorders through behavioral interventions, continuous positive airway pressure (CPAP) therapy, and pharmacologic measures where necessary is integral to effective blood pressure control. Dietary modifications also play a pivotal role in reducing stress-related hypertension. The Mediterranean diet, rich in polyphenols, omega-3 fatty acids, and antioxidants, has been shown to improve vascular function and reduce systemic inflammation. Consumption of foods high in magnesium, such as leafy greens, nuts, and whole grains, supports stress resilience by modulating the HPA axis and promoting relaxation. Additionally, limiting sodium intake and prioritizing potassium-rich foods helps to counteract the hypertensive effects of chronic stress. Social engagement and psychological support are fundamental components of stress management, particularly in elderly individuals who may experience isolation and loneliness. Social connections have been associated with lower levels of inflammatory markers and reduced risk of cardiovascular disease. Participating in group activities, maintaining familial relationships, and seeking professional counseling when needed can significantly improve emotional well-being and, by extension, cardiovascular health. While stress management is an indispensable aspect of blood pressure control, personalized treatment ensures that therapeutic interventions align with each individual's unique health profile. Unlike a generalized approach that focuses solely on numerical blood pressure targets, personalized medicine takes into account genetic predisposition, comorbidities, lifestyle factors, and patient preferences. For example, an elderly patient with hypertension and chronic kidney disease may benefit from angiotensin-converting enzyme (ACE) inhibitors, which provide renal protection, whereas another patient with resistant hypertension may require a combination of diuretics, calcium channel blockers, and beta blockers. Ambulatory blood pressure monitoring (ABPM) is a valuable tool in personalized hypertension management, as it provides a more accurate representation of blood pressure fluctuations throughout the day and night. Traditional office-based measurements often fail to capture the full spectrum of blood pressure variability, leading to misdiagnosis or suboptimal treatment. ABPM allows clinicians to identify masked hypertension, nocturnal hypertension, and exaggerated morning surges, enabling more tailored therapeutic interventions. Another critical consideration in personalized treatment is the assessment of medication side effects and adherence. Many antihypertensive medications, while effective, can cause adverse effects such as dizziness, fatigue, and electrolyte imbalances, which may be particularly problematic in elderly patients. By carefully selecting medications based on a patient's tolerance and comorbid conditions, clinicians can enhance adherence and overall treatment success. Incorporating complementary and alternative therapies into hypertension management can further enhance treatment efficacy. Acupuncture, for instance, has been shown to modulate autonomic function and reduce blood pressure by promoting nitric oxide release and improving endothelial function. Herbal remedies such as hibiscus tea and garlic extract have demonstrated antihypertensive properties through their vasodilatory and diuretic effects. However, it is essential to ensure that these alternative treatments do not interact negatively with prescribed medications. Patient education and self-monitoring play a crucial role in both stress control and personalized treatment. Providing patients with knowledge about the impact of stress on blood pressure and equipping them with tools for self-management fosters greater adherence to lifestyle modifications. Home blood pressure monitoring, in particular, allows patients to track their progress, identify trends, and make informed decisions regarding their health. Studies have shown that patients who actively engage in self-monitoring are more likely to achieve blood pressure control compared to those who rely solely on periodic office visits. Ultimately, the goal of blood pressure management is not merely to achieve a target systolic or diastolic reading but to enhance overall well-being and quality of life. A holistic approach that integrates stress control, lifestyle modifications, and personalized medical interventions provides the most effective and sustainable means of achieving cardiovascular health. By addressing the root causes of hypertension and tailoring treatment to individual needs, clinicians can empower patients to take an active role in their health while minimizing the reliance on medication. As individuals age, their bodies undergo numerous physiological changes that directly impact blood pressure regulation. One of the most significant factors contributing to hypertension in older adults is the stiffening of the arteries. Over time, the elastic fibers in the arterial walls gradually degrade, reducing their ability to expand and contract efficiently. This loss of elasticity results in increased vascular resistance, forcing the heart to pump with greater force to maintain adequate circulation. Consequently, systolic blood pressure rises, leading to a condition known as isolated systolic hypertension, which is particularly common among the elderly population. The decline in hormone levels also plays a crucial role in age-related hypertension. The renin-angiotensin-aldosterone system (ROS), which helps regulate blood pressure by controlling fluid balance and vascular tone, becomes less responsive with age. The kidneys produce less renin, leading to a reduced ability to modulate blood pressure effectively. Additionally, lower aldosterone levels result in altered sodium and potassium balance, which can contribute to increased blood pressure. This hormonal imbalance disrupts the body's capacity to maintain stable blood pressure levels, making older adults more susceptible to hypertension. Kidney function deterioration further exacerbates the problem of high blood pressure in aging individuals. The kidneys are responsible for filtering waste products and excess fluids from the blood while also regulating electrolyte balance. As people age, the glomerular filtration rate (GFR) declines, impairing the kidneys' ability to remove sodium and water efficiently. This leads to fluid retention, increased blood volume, and elevated blood pressure. Furthermore, the kidneys' diminished capacity to excrete waste products can contribute to vascular inflammation and oxidative stress, both of which are associated with hypertension. Beyond these physiological changes, age-related alterations in endothelial function also influence blood pressure regulation. The endothelium, which lines blood vessels, plays a vital role in releasing nitric oxide, a molecule that promotes vasodilation and helps maintain vascular health. Aging is associated with endothelial dysfunction, resulting in decreased nitric oxide production and impaired vasodilation. This dysfunction contributes to increased arterial stiffness and higher blood pressure levels. Additionally, chronic low-grade inflammation, commonly observed in aging individuals, further disrupts endothelial function and exacerbates hypertension. Another contributing factor to increased blood pressure in older adults is the heightened sensitivity to dietary sodium. Aging leads to changes in sodium metabolism, making the body more prone to sodium retention. This increased sensitivity to sodium can cause greater fluctuations in blood pressure, particularly in individuals with a genetic predisposition to hypertension. Reducing sodium intake and increasing potassium consumption through a diet rich in fruits and vegetables can help counteract these effects, but the body's diminished adaptability to dietary changes makes blood pressure control more challenging in older populations. Although over 50% of individuals over 65 develop hypertension, this condition may, in some cases, be a natural adaptation rather than purely pathological. Elevated blood pressure can be a compensatory mechanism that ensures adequate perfusion to vital organs such as the brain and kidneys, especially in the presence of arterial stiffening. However, distinguishing between adaptive and harmful hypertension requires careful clinical evaluation, as excessively high blood pressure increases the risk of cardiovascular events such as stroke and heart failure. Managing blood pressure in elderly patients requires a nuanced approach that balances potential benefits and risks. The choice between standard and intensive treatment strategies is influenced by multiple factors, including the patient's overall health, risk of cardiovascular events, and susceptibility to side effects. Standard treatment typically maintains blood pressure levels at 140 to 150 mmHg, making it a more conservative approach suitable for patients with multiple health conditions. On the other hand, intensive treatment aims to reduce blood pressure to 120 to 130 mmHg, which can provide significant cardiovascular benefits but also carries an increased risk of adverse effects. Standard treatment is often recommended for elderly patients who have multiple comorbidities, as aggressive blood pressure reduction may pose more risks than benefits. Many older adults suffer from conditions such as diabetes, kidney disease, and cognitive decline, which complicate their ability to tolerate intensive therapy. Maintaining blood pressure within the range of 140 to 150 mmHg can prevent excessive drops that might lead to dizziness, falls, or even ischemic events due to reduced cerebral perfusion. Studies suggest that older adults with frailty or multimorbidity experience greater instability when subjected to intensive treatment, making standard therapy a safer and more practical choice in such cases. One of the primary advantages of intensive treatment is the reduction in cardiovascular events, including stroke, heart attack, and heart failure. Several large-scale studies have demonstrated that lowering systolic blood pressure below 130 mm of mercury significantly decreases the risk of these conditions. The SPRINT trial, for instance, highlighted that patients undergoing intensive blood pressure management exhibited lower rates of major cardiovascular events and mortality. However, the same study also reported higher incidences of hypotension, electrolyte imbalances, and acute kidney injury, underscoring the potential dangers of aggressive blood pressure reduction, particularly in older individuals with pre-existing conditions. The impact of different treatment approaches on kidney function is a crucial consideration. In elderly patients, kidney function naturally declines with age due to reduced nephron activity and vascular changes. Standard treatment may be preferable for those with moderate to severe kidney disease, as aggressive blood pressure lowering can reduce renal perfusion and exacerbate renal dysfunction. Intensive therapy, while effective in reducing cardiovascular events, may lead to an increased risk of acute kidney injury, which can further compromise an already vulnerable organ system. Cognitive health is another important factor when comparing standard versus intensive treatment. Blood pressure plays a significant role in cerebral perfusion, and overly aggressive reduction can potentially contribute to cognitive impairment or dementia in older adults. While some studies suggest that intensive control may lower the risk of Alzheimer's disease by reducing vascular-related cognitive decline, others caution that excessive lowering of blood pressure may lead to inadequate brain perfusion, which could accelerate neurodegenerative processes. A balanced approach is therefore necessary to ensure that cognitive function is preserved while mitigating cardiovascular risk. Ultimately, the decision between standard and intensive treatment should be highly individualized. Physicians must assess each patient's unique health profile, including their risk of cardiovascular disease, presence of comorbidities, functional status, and susceptibility to side effects. Shared decision-making with patients and their caregivers is essential in determining the most appropriate course of action. A tailored approach that considers both the potential benefits and risks of treatment ensures that blood pressure management aligns with the overall goal of enhancing quality of life rather than merely achieving numerical targets. Managing blood pressure in seniors requires a comprehensive approach that extends beyond medication. One of the most crucial aspects of maintaining cardiovascular health is regular blood pressure monitoring. This practice enables both patients and healthcare providers to detect fluctuations in blood pressure and respond accordingly. Frequent monitoring helps identify patterns, ensuring that necessary adjustments can be made before complications arise. For example, a patient who experiences consistent morning hypertension may need to modify their medication timing or adjust their daily routine. By tracking blood pressure at different times of the day and in various conditions, individuals can better understand the external and internal factors that influence their readings. Many modern blood pressure monitors are equipped with digital memory storage, allowing physicians to review trends over time and make informed decisions about treatment modifications. Another fundamental principle in blood pressure management is adopting a healthy lifestyle, which encompasses dietary modifications, physical activity, stress reduction, and adequate sleep. Nutrition plays a significant role in regulating blood pressure, with emphasis placed on reducing sodium intake and increasing potassium consumption. Processed foods, which often contain high levels of sodium, can contribute to hypertension by causing water retention and increased vascular resistance. Instead, individuals are encouraged to consume fresh vegetables, fruits, lean proteins, and whole grains, which provide essential nutrients and help maintain vascular health. Foods rich in omega-3 fatty acids, such as salmon and flax seeds, contribute to arterial elasticity and reduce inflammation, further supporting optimal blood pressure levels. Physical activity is another essential component of blood pressure regulation. Regular exercise improves cardiovascular function by strengthening the heart and promoting efficient circulation. Aerobic activities, such as walking, swimming, and cycling, have been shown to lower blood pressure by reducing arterial stiffness and increasing nitric oxide production, which helps dilate blood vessels. Strength training, when incorporated appropriately, also plays a role in improving overall cardiovascular resilience. However, excessive or high-intensity workouts should be approached with caution, particularly for seniors with pre-existing conditions. A well-balanced exercise regimen should be tailored to individual capabilities and gradually increased over time to prevent undue strain on the heart and vascular system. Stress management is another critical factor in blood pressure control. Chronic stress leads to prolonged activation of the sympathetic nervous system, resulting in elevated levels of cortisol and adrenaline. These stress hormones contribute to increased heart rate and blood vessel constriction, both of which raise blood pressure. Techniques such as meditation, deep breathing exercises, and mindfulness practices have been shown to counteract the effects of stress by promoting relaxation and reducing the physiological burden on the cardiovascular system. Engaging in hobbies, social interactions, and activities that provide joy and relaxation further enhances emotional well-being, thereby contributing to stable blood pressure levels. Avoiding excessive medication is another key principle in blood pressure management. While antihypertensive drugs play a vital role in controlling hypertension, over-reliance on medication can lead to undesirable side effects such as dizziness, kidney impairment, and electrolyte imbalances. Some patients experience orthostatic hypotension, a condition in which blood pressure drops significantly when standing up, increasing the risk of falls and fractures. By focusing on non-pharmacological interventions first, many individuals can achieve blood pressure stability without excessive reliance on medication. Physicians should assess the necessity of each prescription, ensuring that patients receive only the medications that are essential for their condition. Regular medication reviews help prevent polypharmacy, a common concern among seniors, where multiple drugs interact and contribute to negative health outcomes. Personalizing treatment based on individual health conditions is perhaps the most critical aspect of managing blood pressure effectively. Each patient presents a unique medical history, genetic predisposition, and lifestyle factors that influence their cardiovascular health. For instance, a patient with diabetes and hypertension requires a different treatment approach than someone with isolated systolic hypertension. Additionally, those with chronic kidney disease may have altered fluid balance and require specific antihypertensive agents that do not exacerbate kidney function decline. By tailoring treatment to individual needs, physicians can optimize outcomes and minimize the risk of adverse reactions. In some cases, alternative and complementary therapies may be integrated into a personalized treatment plan. Acupuncture, for example, has been studied for its potential to reduce blood pressure by modulating autonomic nervous system activity. Herbal remedies such as hibiscus tea and garlic supplements have shown promise in some clinical studies, though their efficacy and safety should always be evaluated under medical supervision. Lifestyle coaching, cognitive behavioral therapy, and nutritional counseling can further enhance adherence to blood pressure management strategies, empowering patients to take control of their health. Another consideration in personalized treatment is the role of socioeconomic factors and access to healthcare. Patients with limited financial resources may struggle to afford essential medications, while those living in rural areas might face challenges in accessing specialized medical care. Telemedicine has emerged as a valuable tool for overcoming these barriers, allowing patients to consult with healthcare providers remotely and receive guidance on blood pressure management without geographical constraints. Community health programs and support groups can also provide education and resources to individuals who may otherwise lack access to medical expertise. Overall, the key principles of blood pressure management in seniors, regular monitoring, a healthy lifestyle, avoiding excessive medication, and personalized treatment, create a holistic framework for maintaining cardiovascular health. These principles, when applied consistently and tailored to the unique needs of each individual, enhance quality of life and reduce the long-term risks associated with hypertension. Managing blood pressure in seniors requires a multifaceted approach that extends beyond merely achieving numerical targets. While medical interventions remain valuable, they must be complemented by a broader strategy that prioritizes overall well-being. Addressing stress through mindfulness techniques, physical activity, and a supportive social environment plays a crucial role in reducing hypertension risks. Seniors who actively engage in stress-reducing activities, such as yoga, meditation, or even engaging hobbies, often report significant improvements in both mental and cardiovascular health. Personalized treatment, which considers an individual's unique medical history, lifestyle, and response to therapies, ensures that care remains patient-centered rather than driven solely by generalized guidelines. Aging naturally influences blood pressure regulation, and while many seniors develop hypertension, it is often a reflection of physiological changes rather than a mere pathology. Stiffer arteries, declining hormone levels, and reduced kidney efficiency contribute to higher systolic blood pressure, making management a delicate balance rather than an aggressive correction. In some cases, a moderate elevation in blood pressure may serve as an adaptive mechanism, ensuring sufficient blood flow to vital organs despite age-related vascular changes. This insight underscores the importance of viewing blood pressure management through a broader lens rather than focusing solely on rigid numerical thresholds. The choice between standard and intensive treatment approaches must consider the benefits and risks associated with each. Standard treatment, which maintains blood pressure within the 140 to 150 mmHg range, is often the safest option for elderly patients with multiple comorbidities. It minimizes the risks of hypotension, dizziness, and kidney complications while still offering protection against stroke and heart disease. On the other hand, intensive treatment, targeting lower levels between 120 to 130 mmHg, has been associated with reduced cardiovascular risks but carries an increased likelihood of adverse effects. Seniors who are generally healthier and more physically active may tolerate intensive treatment better, while those with frailty or underlying conditions might experience more harm than benefit. Thus, a personalized approach remains essential to optimize outcomes without compromising quality of life. Key principles of successful blood pressure management include routine monitoring, lifestyle modifications, and a cautious approach to medication. Regular blood pressure checks allow for timely adjustments, preventing drastic fluctuations that could lead to complications. Adopting a heart-healthy lifestyle, incorporating a balanced diet rich in fruits, vegetables, lean proteins, and healthy fats, provides a foundation for long-term cardiovascular health. Physical activity, tailored to an individual's capabilities, enhances circulation and reduces the impact of arterial stiffness. Avoiding unnecessary medication is another cornerstone of effective management, as overprescription can lead to unwanted side effects that diminish daily functioning. A personalized treatment plan, developed in collaboration with healthcare providers, ensures that interventions align with an individual's specific needs, preferences, and overall health goals. Ultimately, managing blood pressure in seniors requires a nuanced, patient-centered strategy that respects the complexities of aging while prioritizing long-term health. By integrating stress reduction, personalized medical care, appropriate treatment choices, and sustainable lifestyle habits, seniors can maintain optimal cardiovascular function without compromising their overall well-being. The goal is not merely to reach a predefined blood pressure range but to cultivate a state of health that enhances longevity, independence, and quality of life in the later years.